Welcome to another educational video with spinal decompression in Czech Republic. So today we're going to show you, and I'm going to talk a little bit about the nervous system, how it plays a role in assessing and proper assessing what is the actual problem. So the first thing what we need to do is we need to get a standing digital x-ray so we can get a view of the whole spine. So we can see that with this patient, she's a younger girl, so we can see the upper portion, we see the neck. On this portion here there's a little bit of rotation there, and here there's a slight rotation to the left, and then the spine is going to the right. Furthering going, so we see the right rotation on the lower spine, and this is a little bit of a little bit unusual case, but we see this often because normally when you get a left bend, a right bend on the bottom, you probably get a right bend on the top. But in this case, she has both a right bend on the top and a right bend at the bottom. Taking a look at her neck. Typical, she has a completely reverse curve, and so that's going to affect the nervous system, especially the parasympathetic. And so looking at a side view, there is, this are fairly good, so but the L5 is a little bit compressed. So, but she felt a little bit of pain, she felt that she has a problem, but how do the medical world, how do they assess when a patient comes in, they got pain? So what they do is they take an MRI. In an MRI, it's done in a supine position, which is lying down, because the spine is supposed to have a lordotic, orthotic, lordotic curve. So when you're on a supine position, that's going to distort how the spine is. So you're always going to see, okay, on a soft tissue, there's going to be a herniated disc, but then they don't look at the rest of the spine, because discs are a good design. They're tough. They don't herniate unless there's a structural problem. And that's why you've got to look at the whole spine to assess it. And then whenever there's going to be a deviation in the neck, there's going to be a deviation in the thoracic, in the lower, and there's always going to be also a deviation in the pelvis. You've got to look at stabilizing the pelvis, adjusting the pelvis, and then you've got to look at the gait. You have to also take a look at how a person stands. Are their feet straight, or is there a scissor gait where they're like this, or they're walking like this, like a duck. So this all gonna affect the gait, the all alteration. So of how the spine is. So we have to take a look at everything. So in order to properly get the patient better. So we're going to show you now how I'm going to adjust her based on her case, because not every patient is going to be adjusted according to what their problem is. Okay, so no patient is going to be adjusted quite the same. So we have her on abdominal suspension, as you see. So just having her on abdominal suspension will open up. Just move up a little bit. Yes, will open up. We'll get the lordotic curve back, just having a couple of minutes. So as we see by the x-ray, she's bending slight to the right, and it's going in the middle, and then it's going to the right again. So what we're going to do, first of all, is we're going to use a vibration tool, which is a converted jigsaw, and we're always going to be vibrating on the concave side, okay? Because on the convex side is where the postural muscles are going to fire, and to try to stabilize the spine. So you never want to do that. just doing a cervical challenge right now because she's on the right side, so there is more tension on the right side. I'm just applying a little bit of pressure. That's made a little bit worse. Applying more pressure. Okay, that's good. Okay, so as now I'm going to be coming over to this side. So now, as you can see, I'm going to be distracting her, and I'm always going to be distracting her, putting pressure on the right side because that's the convexity. There we go. That's one adjustment already. Putting pressure right over here. Oh, there, you felt that. Ah, there's another one. Good, all the way up the spine. Just distracting her like that opens up those discs and allows her to hydrate. Oh, there's another one. And another one. Good. Okay. So now I'm going to flex her into the concave. So as I'm putting pressure, just a slight drop. That's going to cause inflammation in that area, and that's how the body heals itself. Even I can contact it right here into that area. Good. Right there. More. Just right here into the contact. Good. Good. Nice. We're just going against the vertebral bodies at the lower lumbar to open them up a little bit more. So, gentle drop. Good. Now, gonna do an angio release on this side. Contacting right over here, because this is the good. Okay, so move up. So now this is the cervical drop. So what we want to do is, in order to try and get that curve back, one of the moves we're going to do is a cervical drop. So we set the drop, just contacting the vertebrae right there, and drop. Once again, a little bit more pressure this time. Nice. Okay, so this side up now. Okay. Good. Muscle position. Okay, so this way. So we're going to be contacting on the lower lumbar, just dropping. Upper thoracic. Good. This is the sacrum adjustment, okay, where we contact on the sacrum, roll it over, without letting it fall, and dropping it. Perfect. Okay, other side. Now, we're going to be adjusting this side here because, once again, there is a little bit of a bend this way on the Straight. Good. Okay, just relax, yeah? So right over here, we're going to contact. This is the pelvic adjustment. Just contact the upper pelvis area. Good. On your
Yeah.
So we could see even when I first adjusted her, when I started adjusting her, her neck was like this. Okay, so now when I'm just, it's much straighter. It's not still quite straight, but it's big improvement. Okay. So right now I'm just palpating. So right now I'm just pressure points on the sagittal suture and trying to get to the cerebellum. So which has a little bit of a crevice, which I see on a lot of patients. And this, by stimulating this, of course, you're stimulating the nervous system, and that's the key to regenerating. Because with corrective chiropractors, we're not working with bones or muscles. We have to work with the nervous system, because we have to have the brain reprogram how it views itself in space. This is our sixth sense that we have. Okay, so you're never gonna rehabilitate a patient unless you do the proper corrections and you stimulate the nervous system, reprogram the nervous system. Okay, so now we're going to be adjusting her neck. And the way we do, we're not going to twist her out or do any crazy moves. This is very simple adjustments where we're just putting pressure. Okay, and then just on this side, and just adjust a little bit more on the lower side. Once again, just okay, there we go. Nice. Okay. It's just a little bit of a distraction. You just want to use the patient's own body weight and just thrust just like that. And that's okay. So now we're going to finish her off, because she does go mostly on the right. So most of the adjustments are going to be on the right, then in the middle, and then back to the right again. So we're going to, the middle of the spine is right here, so I'm actually contacting her on the right side and leaning her over. And that's for that one adjustment there. There we go. There, that's a good adjustment. I'm going to finish her out by pressure one more time. One more adjustment. You got one more in you? Let me see. Nice. Okay. Okay, good. The feet also pointing inwards, and you see them pointing down. So that means there's a loss, a little bit of a dorsal flex. And so and there's two exercises that she's going to be doing. She's going to be putting weight on here on the ankles, and then slightly dangling them. And she's going to be dangling them, not pointing this way, pointing that way. Okay, so that will do fix. And also the other exercise is on the block, which is right over here. She's going to be just putting her foot on the block like this and staying for 1 minute. Once again, that will strengthen the intrinsic muscles of the foot. We'll get the soleus pump working better. So besides that, she's going to do other exercises that I'm going to instruct her. Okay? So thank you very much.
Stop.
Yeah.
Good. Okay. Sehr gut. Gut gemacht.